It's 3 a.m. Again. That all too familiar pressure in your bladder has once again shattered your deep sleep. You thought you'd be fine. You went right before bed, and yet here you are, making that cold walk to the bathroom for the second or maybe even third time. You get back to bed, but now you're wide awake. Your mind starts racing. You check the clock, 3:17 a.m. You know that in just a few hours, your alarm will go off and you'll have to face the day on fragmented, junk sleep. You've probably told yourself, this is just part of getting older. It's normal. But what if it's not? What if that nightly interruption isn't just an inconvenience, but a clear signal your body is sending you? A signal that, if you learn to read it, you can finally fix. Today, we are doing a deep dive into why this is happening. We're not just going to list the reasons. We are going to show you how to tell them apart and give you practical, proven strategies you can start using tonight to reclaim your sleep. This is the video you've been searching for. Let's figure this out. All right, first things first. Before we call this a problem, let's establish a baseline. What is normal when it comes to bathroom trips? Especially for those of us over 50, 60, and beyond, our bodies change, and so do our bladder habits. First, let's talk about the daytime. Most urologists and specialists from clinics like the Mayo Clinic and Cleveland Clinic agree, urinating about 6 to 8 times during your waking hours is considered well within the normal range. If you drink a lot of fluids, or if you're on a diuretic, a water pill for blood pressure, this number might be higher, maybe up to 10 times. This is just your body processing fluids as it should. The key is that you're not going every 30 minutes and you don't feel a desperate sudden urgency all the time. 6 to 8 times, that's your daytime baseline. Now, let's talk about the night. This is where the confusion starts. For a person in their 20s or 30s, getting up at night to urinate is rare. 0 times is the norm. For those of us over 50, the rules change. Waking up once per night to use the bathroom is extremely common and is not usually considered a medical problem. It's an inconvenience, for sure, but it's often just a normal part of the aging process. The real problem, and the one we're tackling today, has a medical name: Nocturia. Nocturia is clinically defined as waking up 2 or more times every single night to urinate. This is the threshold. This is when it stops being a simple nuisance and starts becoming a medical issue. Why? Because waking up 2, 3, or 4 times a night absolutely destroys your sleep architecture. You never get enough deep, restorative sleep. This leads to daytime fatigue, brain fog, and irritability. It increases your blood pressure. And most dangerously, for seniors, it dramatically increases your risk of a nighttime fall. That dark walk to the bathroom is one of the most hazardous trips you can make. So, to be clear, 1 time might be normal aging. 2 or more times is a problem we need to solve. The exception? Of course, there are exceptions. If you drank a 32-ounce soda while watching a movie and went to bed an hour later, you can't be surprised when you wake up. We're not talking about a self-inflicted bad night. We are talking about a consistent, chronic pattern of waking up 2 or more times, even when you try to do the right things. So why is your body forcing you to do this? The cause of your nocturia isn't a mystery. In fact, for the vast majority of people, it falls into one of these 5 main categories. I'm going to list them briefly now, and then we'll break down each one. Number 5, a simple problem of physics and gravity. Fluid that you collect in your body all day is leaking back into your system at night. Number 4, a metabolic red flag. Your body is struggling to manage its blood sugar, and your kidneys are working overtime to flush it out. Number 3, a storage tank problem. The issue isn't the amount of urine, but the bladder's ability to hold it, or for men, a problem with emptying it. Number 2, a hidden sleep thief. You might be surprised to learn that you're not waking up because you have to pee. You're waking up for a different, more dangerous reason, and then you notice your bladder. And number 1, the master switch. This is perhaps the most common reason for people over 60, a specific age-related hormonal shift that tells your kidneys to keep making urine all night long, when they should be resting. Okay, If you recognized yourself in any of those descriptions, pay very close attention. Here's my promise to you. For each of these 5 reasons, I'm going to give you the specific symptoms to look for. This is the most important part. This will help you become a health detective and distinguish why this is happening. The symptoms for a bladder problem are very different from the symptoms of a blood sugar problem. Then, after we identify the cause, I will give you practical, actionable advice. These are not vague get more sleep tips. These are specific behavioral and dietary strategies proven by research that you can use tonight to start seeing improvements. We're going to follow the core rules of good sleep hygiene, which means I will never advise you to eat within 3 hours of bedtime or drink any significant fluid within 2 hours of bedtime. Those are the non-negotiables. Our tips will work with those rules. Let's begin the countdown. Number 5, gravity's revenge, peripheral edema. We're starting with number 5, and this is a purely mechanical problem. The cause isn't your bladder or your kidneys, it's your legs. The problem is called peripheral edema, which is a medical term for fluid retention in your legs, ankles, and feet. How do you know if this is you? It's very easy to spot. Look at your ankles at the end of the day. Do they look puffy or swollen? When you take your socks off, do you see deep, lingering lines or indentations in your skin? Do your shoes feel much tighter in the evening than they did in the morning? When you wake up at night, especially in the first half of the night, say at 1 a.m., do you urinate a very large amount? Do you find that your ankles are back to normal in the morning, only for the cycle to repeat? If you're nodding yes, this is very likely a major contributor for you. Think of your body like a 2-story house. During the day, you are sitting or standing, so you're upstairs. Gravity combined with aging veins that aren't as efficient at pumping blood back up causes fluid, water, to pool in the basement, which is your lower legs and ankles. Your kidneys, which are the filtration system on the 2nd floor, can't process this fluid because it's trapped in your legs. Then you go to bed. You lie down flat. Whoosh. All that fluid that was trapped in your basement all day long is no longer fighting gravity. It flows right back into your bloodstream. Your body senses this fluid overload, and your kidneys, the filtration system, finally get their chance. They kick into high gear and say, we have to get rid of all this extra water. They start producing a large amount of urine. Your bladder fills up quickly, and bam, you're awake. Since this is a mechanical problem, we need a mechanical solution. 1. Elevate your legs before bed. This is the single most effective tip. You must lie down and elevate your feet higher than your heart for at least 1 to 2 hours before you go to sleep. Don't just prop them on a low footstool. Lie on the couch or in bed and put 2 or 3 pillows under your calves and ankles. 2. Timing is everything. Do this from, for example, 8 p.m. to 9:30 p.m. while you read a book or watch TV. This pre-sleep elevation forces that fluid back into your system while you are still awake. You will find yourself getting up to pee before you go to bed. You are emptying the tank on your schedule, not your bladder's. 3. Wear compression socks. During the day, wear mild compression socks. This helps prevent the fluid from pooling in your legs in the first place. 4. If you sit at a desk all day, get up every hour. Do some simple calf raises or ankle pumps. This contracts your muscles and helps push that fluid back up, keeping the basement from flooding. This is simple, proven physics. Geriatric studies have shown that a period of pre-sleep leg elevation can significantly reduce the number of nighttime bathroom trips. You are simply shifting the time of urination from 2 a.m. to 9 p.m. If this aha moment just hit you, if you're someone who sees those sock marks every single night, do me a quick favor and tap that like button. It lets me know this information is helpful and truly helps support the channel. Thank you so much. Okay, let's continue to number 4. Number 4, the blood sugar connection, diabetes or prediabetes. Coming in at number 4 is a major red flag that your body's metabolic system is under stress. We are talking about high blood sugar, also known as hyperglycemia. This is a hallmark symptom of type 2 diabetes, but it's also extremely common in the millions of people who are pre-diabetic and don't even know it. The symptoms here are different from edema. They are systemic. Are you waking up thirsty? Do you keep a glass of water by your bed because your mouth is dry, a symptom called polydipsia? Are you also urinating frequently during the day, not just at night? Do you feel unusually hungry, polyphagia? Are you experiencing unexplained weight loss, blurry vision, or a pins and needles tingling in your hands or feet? Is your urine volume very high every time you go? These are classic textbook warning signs. This is a simple biology lesson. Think of your bloodstream as a river. When you have high blood sugar, it's like someone dumped a ton of sugar into that river. The blood becomes thick and syrupy. Your body hates this. It's dangerous. So, it launches an emergency response. It needs to dilute the syrup. It starts pulling water from all your body's tissues, from your skin, your muscles, your eyes, and dumps it into the bloodstream to thin out the sugar. All this extra water now floods to our kidneys. Your kidneys, which are trying to save you, see all this excess sugar and say, "We have to get this poison out." They start working overtime, filtering out the sugar and dumping it into your bladder, and a lot of water comes with it. This process is called osmotic diuresis. It doesn't stop just because you're asleep. Your body is desperately trying to manage the sugar crisis, and it will wake you up as many times as it needs to flush it out. 1. See your doctor. This is not a wait and see problem. You must schedule an appointment and ask for a fasting blood glucose test and, more importantly, an A1C test. The A1C gives a 3-month average of your blood sugar and is the gold standard for diagnosis. 2. Stop late-night carbs and sugar. This is our 3-hour eating rule, but it is critical for you. A late-night snack of cookies, ice cream, cereal, or even a lot of fruit will spike your blood sugar exactly when your body is least equipped to handle it, due to natural insulin resistance at night. That 9 p.m. sugar spike is the direct cause of your 2 a.m. bathroom trip. 3. Focus on your last meal. Make your dinner protein-focused with healthy fats and fiber, like chicken, fish, avocado, and vegetables. This provides stable energy without the sugar surge. 4. Go for a 10-minute walk. After your dinner, a short 10-minute walk can do wonders for helping your muscles absorb that blood sugar, taking the load off your kidneys. The American Diabetes Association, ADA, lists excessive urination, polyuria, and thirst, polydipsia, as 2 of the primary symptoms of diabetes. For countless patients, when they get their blood sugar under control through diet, exercise, or medication, their nocturia symptoms improve dramatically or disappear completely. You're not fixing the symptom, the peeing, you're fixing the root cause, the sugar. Number 3, the storage tank problem, OAB or BPH. At number 3, we have a plumbing issue. This is when the problem isn't the amount of urine your kidneys are making, but rather an issue with your bladder, the storage tank itself. This breaks down into 2 main categories: overactive bladder, OAB for both men and women, and benign prostatic hyperplasia, BPH, or an enlarged prostate for men. The key word for this category is urgency. For OAB, men and women. Do you suddenly get a desperate, overwhelming urge to pee? Does it feel like you can't hold it like you used to? When you wake up, do you have to run to the bathroom? Crucially, when you do go, is the amount of urine often small? This is the classic sign: high frequency, low volume. For BPH, men only, do you have trouble starting the stream? Is the stream itself weak, or does it stop and start? Do you feel like you never fully empty your bladder? Do you dribble after you're finished? This incomplete emptying is the problem. Your bladder is a muscle, the detrusor muscle. In a healthy bladder, it stays relaxed as it fills and only contracts when you tell it to. In an overactive bladder, that muscle becomes twitchy or irritable. It contracts and sends "emergency, I'm full" signals to your brain even when it's only a little bit full. It's like a hypersensitive car alarm that goes off from a gust of wind. For men, the prostate gland is a small gland about the size of a walnut that surrounds the exit pipe, the urethra, right at the base of the bladder. As men age, this gland often grows larger. Imagine squeezing a garden hose. This enlarged gland squeezes the pipe, so even if your bladder is full, you can't get all the urine out. You only empty it halfway. Your kidneys keep working, and 90 minutes later, that half-empty bladder is full again. See a urologist. For both OAB and BPH, a proper diagnosis from a specialist is key. They can run simple tests to see how well your bladder is functioning. And, for men, check your prostate. 2. Cut out bladder irritants. This is huge. Certain foods and drinks make a twitchy bladder worse. Starting in the afternoon, cut out caffeine, coffee, tea, soda, alcohol, spicy foods, acidic foods like tomatoes, and artificial sweeteners. For many, this alone solves the problem. 3. Bladder training for OAB. This is behavioral therapy. When you feel the urge, don't run. Stand still, take a deep breath, and wait 5 minutes. Contract your pelvic floor muscles, a Kegel. The urge will often pass. By slowly extending the time between voids, you are retraining your bladder to hold more. 4. Double voiding for BPH. Men, try this. After you urinate, stay at the toilet, relax for 30 seconds, and then try to go again. You'll often be surprised that you can empty another few ounces. This helps empty the bladder more completely. 5. Medical options. For BPH, there are excellent safe medications like alpha blockers that relax the prostate squeeze and dramatically improve flow. For severe OAB, other medications can calm the twitchy. Bladder muscle. The Urology Care Foundation confirms that behavioral changes, like eliminating irritants and bladder training, are the first line of defense for OAB. For BPH, solving the retention problem with medication or a procedure directly addresses the cause of the frequency, as a fully empty bladder simply takes longer to fill up again. Number 2, the hidden sleep thief, sleep apnea. This next one is incredibly common and dangerously underdiagnosed. It's a complete paradigm shift. What if you're not waking up because you have to pee? What if you are waking up because you stop breathing, and then in that moment of wakefulness, you simply notice your bladder? This is obstructive sleep apnea, OSA. Ask yourself or your partner these questions. Do you snore? Not just a light rumble, but loud, chronic snoring? Has your partner ever told you that you gasp for air, choke, or stop breathing in your sleep? This is the number one sign. Do you wake up with a dry mouth or a morning headache? Are you exhausted all day long, even after 8 hours in bed? Do you fall asleep watching TV or reading a book? Do you often wake up suddenly with a pounding heart and then feel the urge to pee? This is fascinating. When you have OSA, the soft tissues in your throat relax and collapse, blocking your airway. You stop breathing for 10, 20, or even 30 seconds at a time. Your brain senses this no oxygen emergency and sends a jolt of adrenaline to save you. This jolt forces you awake with a gasp. This happens dozens or even hundreds of times a night. You're not aware of most of these micro-awakenings, but they pull you out of deep sleep. This process does 2 things to make you pee. Number 1, it just wakes you up. And when you're suddenly awake at 3 a.m., you're going to notice any sensation, including a half-full bladder, and decide to go just in case. It creates a hormone cascade. This is the real culprit. That nightly struggle for air puts immense physical stress on your heart. Your heart interprets this as a fluid overload problem. In response, it releases a specific hormone called ANP, whose only job is to tell your kidneys, dump fluid, reduce blood pressure now. So your own body is actively producing more urine at night as a direct response to your breathing crisis. 1. Talk to your doctor about a sleep study. This is the only way to know for sure. Your snoring and fatigue are medical symptoms. Your doctor can refer you for a sleep study, which is often done easily at your own home. 2. Positional therapy. Sleep apnea is almost always worse when sleeping on your back. Try sleeping on your side. A common trick is to get an old t-shirt, put it on backward, and place a tennis ball in a pocket sewn into the back, between your shoulder blades. If you roll onto your back, the discomfort will make you roll back to your side. 3. Address lifestyle factors. OSA is strongly linked to excess weight. Losing even 10% of your body weight can dramatically reduce, or in some cases, completely eliminate sleep apnea. Also, avoid alcohol before bed, as it relaxes your throat muscles even more. Or get treated, CPAP. If you are diagnosed, the gold standard treatment is a CPAP machine. It provides a gentle stream of air that keeps your airway open. It is life-changing. Ask anyone who uses one. And for many, their nocturia vanishes within the first week of treatment. Studies in journals of sleep medicine and urology have proven this link. When patients with severe nocturia are treated with CPAP, their nighttime urination episodes decrease by over 60 to 80%. You're not treating the bladder. You're treating the suffocation that's triggering the bladder. Number 1. The master switch, low vasopressin ADH. And here we are at the number 1 reason. If you've ruled out the others, or if you are over 60, this is the most probable cause. The problem isn't your legs, your blood sugar, your bladder, or your breathing. The problem is a simple, age-related hormonal change in your brain. The culprit is a hormone called antidiuretic hormone, ADH, also known as vasopressin. This condition is called nocturnal polyuria, meaning too much urine at night. The primary symptom is high volume at night. You're not waking up to pee a tiny, urgent amount. You are waking up 2, 3, or 4 times with a full to bursting bladder every single time. You might notice that you're just producing a lot of urine in general, but it gets significantly worse at night. A good test, if you're willing, is to measure your urine. If your total nighttime urine volume is more than 1/3 of your total 24-hour volume, that is the textbook definition of nocturnal polyuria. This is the simplest one to understand. Think of your kidneys as a dam with gates. During the day, the gates are open, and your kidneys filter your blood, letting excess water, urine, through. At night, when you go to sleep, your brain is supposed to release that special hormone, ADH or vasopressin. This hormone is the nighttime dam operator. Its job is to travel to your kidneys and tell them, close the gates. It's nighttime. We need to conserve water. Slow down urine production until morning. This is why a healthy person can sleep 8 hours without needing to pee. Here's the problem. As we age, our brains often get less efficient at producing this hormone at night. The dam operator doesn't show up for his shift, or he falls asleep. As a result, the gates on the dam stay open. Your kidneys never get the slow down signal. They just keep producing urine at full daytime levels all night long. Your bladder fills up again and again and again. This is a fluid production problem, so we must manage it with fluid timing. The 2-hour fluid curfew. This is your most powerful tool. You must stop drinking all significant fluids 2 to 3 hours before your head hits the pillow. This is not optional. A tiny sip of water to take a pill is fine. A glass of water, a cup of herbal tea, or a glass of milk is a disaster. 2. The 3-hour food curfew. Remember, food is fluid. A big bowl of soup, a juicy orange, a slice of watermelon, or a bowl of ice cream for a late-night snack is just as bad as a glass of water. Adhere religiously to the no eating within 3 hours of bed rule. You want to go to bed with your stomach and your bladder as empty as possible. 3. Check your salt. A high-sodium dinner like a frozen meal, fast food, or soy sauce will make you thirsty all evening. You'll drink more water, and that salt will make your body flush fluid later that night. Have a low-sodium dinner. 4. Medical option. Talk to your doctor. If these behavioral changes are not enough, there is a medical solution. Talk to a urologist. There is a prescription medication, a nasal spray or a tablet that melts under your tongue called desmopressin, which is a synthetic version of that exact hormone. It's the dam operator in a bottle. It is highly effective for this specific condition. This is basic endocrinology, the study of hormones. This hormonal shift is one of the most studied and well understood parts of geriatric urology. The recommendations for strict fluid restriction are the first-line defense given by every major medical institution, from Johns Hopkins to the Cleveland Clinic. You are giving your kidneys a low-fluid environment before the dam operator clocks out. So there you have it, the 5 most common reasons you're not sleeping through the night. Now I want to hear from you. Please take a moment and share your story in the comments below. Based on these descriptions, which one of these reasons do you think is causing your nightly interruptions? When you share your experience, you not only help us, but you might help someone else in this community who is reading and feeling alone in this struggle. And finally, if you found this information valuable and you want more practical, no-nonsense health advice for living better after 50, please subscribe to the channel and click that notification bell. Remember, Understanding why is the first step to finding the solution. Be patient with your body, talk to your doctor, and try these tips. You deserve to sleep through the night. Be well.